A very common question, and a very serious question, is how does hormone therapy affect cancer? Does it stop it from happening? Does it make it happen? And if I'm post cancer treatment, can I take hormones now? So that's an interesting question. Most of your doctors will say no to hormones if you've had cancer, particularly if you've had female cancers like breast cancer or ovarian cancer. Those physicians are referring to the Women's Health Initiative, which was a study done in the early 2000s, where they used Premarin and Provera, two synthetic hormones, at two arms of the study. And that study was closed 2 years into a 10-year study. The reason was it was causing breast cancer, ovarian cancer, heart attacks, strokes, and early dementia. What they found is that when those same studies were repeated, mainly in Denmark and Finland, with large numbers of women using bioidentical hormones, it had just the opposite effect. It was cancer preventative. It also helped people post-cancer treatment to not have recurrences. There's a lot of literature on that right now. It's controversial, but there's an evolving body of knowledge that says that it doesn't cause cancer and indeed may prevent you from getting cancer. Rebecca Glasser, one of the preeminent breast cancer surgeons, spent the last 9 years showing that her recurrence rate is about half the recurrence rate nationally when she puts all of her post-op women on testosterone after breast cancer. So I can't say that it prevents cancer. I can tell you that testosterone, the literature shows, is apoptotic or kills breast cancer cells. So the jury's still out, depends on who you talk to. Putting you on testosterone after breast cancer does not affect the estradiol, which is the estrogen which people are worried about being sensitive to. But it does make women feel a lot better during the post-op period or the post-treatment period. And it seems to be, according to Rebecca Glasser's literature, it seems to be decreasing the chance of recurrence, which I think most people would find very beneficial. So come talk to me. There's a lot more to know about this, and I'd be glad to talk to you about it anytime. Come see me.